Hi, Mrs. Jones.
I'm sorry, it's Mr. Jones.
Oh, I'm so
Or
sorry.
it's Mr.
Well, I'll be assisting Nurse Callie today. I apologize. Hello, Mr. Jones. My name's Callie. I'll be working with you today. Nice to meet you. And you are?
Hi, I'm Michaela.
Michaela. Okay.
Uncle Al's niece, and my sister will be joining us shortly.
Okay, perfect. So I'll be giving you some education today about your condition and then answer any questions that you guys might have.
There's
Hello.
Callie, this is my sister.
Hello, nice to meet you. I'll be working with you guys today. There's a few types of strokes. There's one where there's an obstruction of blood flow in your brain, and then there's one where a blood vessel ruptures, which is the type that you had, which is called a hemorrhagic stroke. So here's all of the different types of strokes, and here's the section about hemorrhagic strokes.
So since our uncle is in transitioning, was female, now male, he's taking all these medications to boost his testosterone. Is there going to be any reactions or side effects from the new medication mixed with his transitioning medications?
See? I can get that information to you and provide you a list of all of his medications and their side effects and cross-reference those and see.
Thank you. We really appreciate that.
So there are a couple things that can make you more likely to have a stroke. Some things that you can't change, like age and ethnicity and things like that. But there are some things that you can change. For example, atherosclerosis or just buildup of plaque in your veins can cause an obstruction. So that can make you more likely to have a stroke.
So Uncle Al's been eating steaks every night for 50 years. Does that mean he'll have to cut those out?
Well, that can have an effect. You probably want to do a more balanced diet with more fruits and veggies and less fats, because that can cause buildup in your veins. And also with your trouble chewing and swallowing, you're going to want to change the texture of your diet as well.
I noticed that. I was trying to feed Uncle Al chips and he just kept choking on them.
Yep, that will cause it. That's called dysphagia.
So what kind of diet do we need to keep up with that?
Well, we would probably want a softer diet. I'd have to refer to dietary, but probably something soft and thickened liquids as well, because there's a higher chance of aspiration. And I also see that you have some cigarettes. Are we all smokers here?
Yeah, Uncle Al's been smoking for the past 50 years. He smokes about a pack a week.
Okay, well that can be another risk factor that can cause you to have high blood pressure as well. And then any other drug or alcohol use can influence strokes as well.
So how can we go about helping him to quit?
Well, we can start him on a cessation program while we're here. We can get him one of those little patches, and that can help you. Next, we'll talk about how a stroke can affect your body. So strokes are different for everyone, but some general signs you'll have are weakness in one side of your body, like you're having, and also trouble swallowing, trouble eating things, which you're also having.
Do you want to verbally
Is that why
address
his
what
voice
you're
is
looking
like that?
at?
Well, that's another thing, but it's called dysarthria, which is just trouble speaking. That can happen as well. It's a separate issue, but it's also common.
So what kind of therapies can we do to rehabilitate his speaking? Hopefully get him
What is that
talking
term?
full sentences again.
Well, we can have speech therapy come in and work with them every day, and also have them come in and help with his swallowing, and dietary will come in as well. There can also be some changes in behavior or some confusion, so don't be alarmed if that happens, because that's pretty common.
Do you have any pain
Do you
right
have any
now? Maybe
questions?
the wife can answer for him, and then the nurse.
When
will
can I
say
go
it
home?
to him.
Well, that all kind of depends on how your rehab goes. The effects of a stroke are strongest when they first happen, so in a couple of days to a couple of weeks we'll see the permanent changes that have happened, and then we'll see rehab and see how you do, okay?
I don't want to go to a home.
You don't want to go to a home? Well, from what I understand, your nieces are here to help you, and lots of people have family members help them with strokes. Here are some preventative measures that you can take to prevent from having another hemorrhagic stroke. So we'll have you continue taking your antihypertensives, and then we really need to get you to stop smoking. Some other things you can do to help prevent other types of strokes are just reduce your cholesterol and fat intake and watch your weight. After your rehab here in the hospital with physical therapy, occupational therapy, speech therapy, and dietary, we'll get you started on your rehab at home, and things you need to focus on are exercising, taking your medications like your antihypertensives, and having just a good balanced diet. So no steaks every night, okay? Some important things to remember about your diet is that you might have to change the texture and thicken the liquids for a longer period of time or permanently, depending on how you do.
How can we thicken these liquids?
Well, there's a couple ways to thicken liquids. You can buy the pre-made thickener that doesn't really taste like anything, and you can also use a cornstarch mixture that also thickens it, and depending on what dietary says, it's either nectar thick or honey thick. In the future, if you were to have another stroke, there are some signs and symptoms to watch out for. So we have an acronym that we use here at the hospital called FAST, and the F stands for any facial drooping on one side, and then A stands for arm drooping on that same side, and then S is for speech, so if there's any slurred speech or difficulty with words, and then T stands for time, meaning if you see all those symptoms, you need to go to the hospital or call as soon as you can, because time is essential. Alright, I know that was a lot of information for you guys, so I'm going to go ahead and give you this pamphlet, and I can make copies if you would like. Do you have any questions or concerns, or can you just explain to me what I explained to you briefly?
Well, he had a hemorrhagic stroke. That's going to definitely change his diet. We need to remember fast.
So he needs to quit smoking. And in the future, we need to look for FAST, so facial drooping, arm drooping, speech difficulties, and time is a key element.
Do you want to take off flash?
And right now, I'll give you the opportunity specifically to ask any questions that you might have. Take your time. I just want to know if you, the patient, have any concerns. Well, I guess that's all I have for you guys.
Thank you.
Thank you.
It was very nice to meet you, Kelly.
It's really nice to meet you.
I'll be in later to check on you, Al, okay?
Okay, thank you.
Thank you.
Hello, Mr. Al. I am Jackie, the dietitian here at the hospital.
Hi, I'm his niece.
Nice to meet
Nice
you.
to meet you.
So we performed that swallow test earlier. I'm sad to say that you did fail it, so we'll have to take some precautions for when you eat and when you drink. Okay, I know that Nurse Callie came in and talked to you guys earlier about thick and liquid diets, which you will have to be on one. And she explained to you that you can either get it through cornstarch, or you can go to the store and buy the bottles of it. And there's guidelines on the bottles that will tell you like how much to pour into each of these liquids. So now, there's some other precautions that you can take when eating. First, you can raise the head of the bed 45 to 90 degrees.
Is this about good right here?
Yep, that should be fine. That's just to prevent aspiration. Another thing to prevent aspiration is you never want to drink out of a straw. So no more using straws, so if you do that.
He really likes milkshakes after dinner every night.
Yep, milkshakes are fine. Just like I said again, you can't drink it out of a straw.
Okay.
You'll just have to sip it out of a cup, whatever's easiest, but no straws. Other things that you can do, you never want to leave him alone when he's eating. This can be a choking hazard. He can choke on his food. Always cut his food up in little, smaller pieces to help with, he has weakness in his arms, correct? Okay, to help with that, you can buy gripping silverware, and it'll just help to hold, like, because little silverware is thin and small. So this gripping silverware, it's kind of round, cylindrical. You can pick it up, and it'll help with steadying his hand so it won't be so shaky, and that'll help him eat. All right, and I would also suggest being on a mechanical soft diet. So this is just softened foods like your applesauce and mashed potatoes, steamed vegetables like cooked carrots, everything that would be soft and okay.
Could you still eat? Is hamburger meat okay?
Hamburger meat is fine as long as it's ground up, cut up. You want to be able to chew it
Then we'll just have to
without
cut around.
choking or aspirating on it.
You know what I mean?
I don't have a lot of information for you guys. Do you have any questions or any concerns? Can you relay the information back to me so I know that you understand it?
He has to have thickened liquids, but milkshakes are still okay. Just without a straw. Mechanical soft diet, so like applesauce, cottage cheese, and he can still eat meat. It just has to be like ground click
videos on your normal app.
Yes, it is. Don't forget to keep the bed, head of the
right,
bed elevated,
yes.
and stay with him when he eats, and just cut up his
Yes.
food. And other than that, I think you guys got it. It was very nice to meet you, Mr. Al.
Thank you.
And you
It was
as well.
nice to meet you.